As Canadians get ready to roll up their sleeves and travel down the road to a vaccine, they seem to be hitting some congestion with the rollout. I'm here outside Trillium Queensway Health Center Hospital, one of at least 17 official vaccine clinics in the province. Now, as Canada announces a temporary 4-week delay in vaccine shipments, which will half expected supply and put more folks in the road to getting vaccinated, we spoke with a professor who broke down what the slow rollout could mean for Canadians.
It's not the end of the world, but it certainly will put a huge dent in things. And, when our leaders say to us, don't worry, we'll pick it up later, I find that a bit offensive because the problem is we're in a crisis now. We've got active outbreaks and we have people dying. And we've kind of heard enough about what's going to happen later. The question is, what's going to happen now?
Of the 27,000 doses of vaccines that have been delivered to the province, 42% remain in freezers across the province. Now, with a federal delay announced, Premier Ford struck an optimistic tone, saying, "We will adjust as necessary," recognizing the fact that Ontario will soon have a baseline capacity to vaccinate nearly 40,000 people a day, with the ability to triple or quadruple this capacity with notice. At this time, the province's 7-day average for daily vaccinations stand just over 12,000 doses administered a day. While the supply delay is only a short-term problem, provinces will now have to readjust and won't be able to scale back up until at least the first 2 weeks in February. Canada was supposed to have between just over 124,000 and 366,600 Pfizer doses every week between now and February. This was part of the plan to have 6 million doses total of Pfizer and Moderna by the end of phase 1 of the vaccine rollout. While Professor Bowman doesn't believe the government should have to pull a rabbit out of a hat and solve this, there is something they can do.
My position on this is one of transparency. What are the delays? We've never even been told what these contracts exactly say. We don't know. Other nations, they've been disclosed publicly. We don't know. We're not hearing anything about AstraZeneca, which would be another vaccine pipeline. Are we looking at days, weeks, months? Who knows? Or have they lost interest in it? I don't know. So, these are the things that really concern people.
Toronto announcing today a small ray of hope, saying that the vaccine has now been rolled out to all 87 long-term care homes in the city. They said in part, more than 10,322 residents and 2,893 staff and essential caregivers have now been vaccinated with the Moderna vaccine on site. And staff and essential caregivers have attended hospital clinics to receive the Pfizer BioNTech vaccine. Federal officials mentioned today that they believe that the country remains on track to vaccinate everyone who wants to be by the end of September. When talking about the temporary delay of the Pfizer vaccine, the federal government did mention that will not affect the shipment of almost 81,000 doses that is supposed to arrive next week. It is the following week where we will see a significant impact.